Three. 3% of all babies will be born with a birth defect. 20.
20% of all infant mortality is due to birth defects. So what is a birth defect? A birth defect is any physical abnormality that's present at birth. Over 4,000 different birth defects have been identified.
There are two main types of birth defects, structural and functional. A structural birth defect is when a specific body part is missing or malformed. Examples include cleft lip and heart defects. A functional birth defect causes a body part or system to not work properly. Examples include Down syndrome and cystic fibrosis.
While many specific causes are unknown, there have been several factors known to correlate. For example, with genetics, if there is any previous history of birth defects in the family, then it is likely to be passed on to the child.
Lifestyle choices and behaviors have also been shown to cause birth defects. For example, if a mother smokes, drinks alcohol, or does drugs while she is pregnant, then the baby is likely to develop a birth defect. Exposure to certain chemicals and radiation can also cause problems to a baby's development.
The contraction of different infections or viruses during pregnancy can also affect the baby's development. While many of these viruses can be contracted through sexual contact, there are a few, such as the Zika virus, which can be contracted through natural means.
Birth defects can cause many concerns during pregnancy. Most birth defects are present within the first 3 months of pregnancy when organs are still forming. These birth defects may affect appearance, organ function, physical, or mental development. Some symptoms are visible at birth, while others are not shown until years after the child is born. These symptoms can be either minor or severe. Age is also a contributing factor due to the fact that older mothers have an increased risk for having a baby with a birth defect.
The chain of causation cannot be determined because there are over 4,000 different types of birth defects that can be caused by many different factors. Theories can be made about the causes of certain birth defect cases, but there are no defined causes or cures.
The good news is that there are prevention strategies you can take to prevent your baby from being born with a birth defect. Step 1 is to plan ahead. Pregnant mothers should check up with their healthcare professional regularly and take the vitamin B, folic acid, which has been shown to prevent major birth defects affecting the brain and spine. Step 2 is to avoid harmful substances such as alcohol and smoking at any time during pregnancy. Step 3 is to choose a healthy lifestyle. It is important for pregnant mothers to eat healthy foods and maintain a healthy weight to help avoid complications during pregnancy. Step 4 is to talk with your healthcare provider about taking certain medications and vaccinations in order to keep both you and your baby healthy. The United States spends $2.6 billion annually on hospitalization for treating birth defects.
There are several ways that public health and community can help. The first is to raise awareness, such as with the Special Olympics. But most of all, showing support and acceptance can be the best thing for those with handicaps, like with Clemson Life here in Clemson. Birth defects are related to public health because there is currently no cure, and the only solution available is prevention. As birth defects are oftentimes debilitating, everybody should be aware of the risks.
So how does the 4-part definition of public health apply to birth defects? The public health mission is the fulfillment of society's interests in ensuring the conditions in which people can be healthy. People expect healthy living conditions, even those that choose to partake in dangerous behaviors such as smoking. Public health's mission in treating and curing birth defects is to create an environment where people can choose to be healthy. Substance involves organized community efforts aimed at the prevention of disease and the promotion of health. In relation to birth defects, examples include jobs, the Special Olympics, and school programs such as Clemson Life that give students with birth defects the opportunity to live a normal life.
The organizational framework of public health includes activities undertaken within the formal structure of government and the associated efforts of private and voluntary organizations and individuals. The Special Olympics is an example of this as well, because over the last few decades it has gained support from every level of society, from the individual communities in each state to international competitions, and now has branches and events in 170 countries around the world. The three core functions of public health are assessment, policy development, and assurance. For assessment of the public's health, the number of new cases of birth defects in the United States is increasing every year, becoming more common without any substantial supportive evidence behind the cause. For policy development to establish health treatment plans, well, presently, the only significant policy development that involves birth defects in the United States treats the symptoms but not the cause. There are countless programs to help support those with birth defects, but fewer that help prevent them in the first place. For assurance that the health services are available and accessible, technology is available to diagnose some birth defects before the baby is even born. Medical facilities exist that specialize in treating birth defects, and new medicine is constantly being created and tested to treat birth defects. There are a few controversies relating to birth defects in the U.S. One controversy is that childhood vaccinations are the cause of autism, while another states that receiving a prenatal ultrasound increases their risk factor of contracting a birth defect by 3. Action can be taken through research, new medical treatments, but most importantly, early prevention.
The Clemson Life program has changed David's life in many ways. Not only did it give him the chance to be a college student, but David himself earned a spot as a member with one of college football's most elite programs.
I'm going to introduce you to my main man, David Seville. This is one of the greatest ambassadors that we have at Clemson University.
P.S. Go Tigers.